If you're moving medical equipment like CT scanners, hospital beds, or imaging systems, you can't afford to treat that freight like a standard load. I say that because I've seen what happens when people assume it's just another shipment. Delays, damage, miscommunication, and in some cases, thousands of dollars lost on machines that were improperly handled. This kind of freight has unique needs, so let's talk about exactly why you need a different mindset and a different partner when it comes to shipping medical equipment. Most medical devices aren't just expensive, they're incredibly delicate. We're talking about high value machinery with sensitive wiring, imaging components, and calibration that can throw off by one bad bump. That means no stacking, no rough handling, no guessing. It requires precise preparation and clear communication with the carrier. A freight partner who treats it like another pallet load, that's liability you can't afford. Not every truck is built or trained for this kind of freight. You need air ride trailers, climate control in some cases, and drivers who understand how to secure specialized cargo. This isn't the job for the first carrier who says yes. I only work with experienced carriers who've moved medical loads before because the cost of inexperience is just too high. The drop-off point for this kind of load is often a hospital, a clinic, or medical facility, not a loading dock. That changes everything. You need timed deliveries, sometimes with restricted access or staff coordination. The driver needs to know what to expect and follow strict guidelines. I make sure those site-specific needs are locked in from the start so there are no surprises at delivery. If you're shipping a machine worth six figures and your broker doesn't confirm that the carrier has matching insurance coverage, you're exposed. This happens more often than people realize. A shipment gets damaged and suddenly you're in a fight for reimbursement you'll never fully see. That's why I make sure the carrier's insurance lines up with the freight value before the wheels ever start turning. When medical equipment is being moved, it's not just about logistics, it's about lives. That equipment might be scheduled for use in a clinic the next day. Delays or reschedules can affect patient care, treatment schedules, or installations that hospitals are counting on. A freight partner who understands that moves with urgency and accuracy, not just speed. Medical equipment freight isn't about being the cheapest or the fastest. It's about being right, like the right trailer, the right timing, right paperwork, and the right carrier. That's the approach I bring to every medical shipment I move. Because when people's health and safety depends on it, there's no room for shortcuts. At the end of the day, shipping medical equipment requires more than a quote in a truck. It takes planning, precision, and a partner who understands the stakes. If you've got a shipment coming up or you just want to make sure your future moves are handled the right way, reach out. I'm here to make sure you're covered from pickup to delivery with the care and attention this freight deserves.